Every woman who lives long enough will face it. The hot flashes that strike without warning, the night sweats that destroy sleep, the mood swings that strain relationships. Menopause affects over 1 billion women worldwide, and for many, the symptoms are severe enough to disrupt daily life. For decades, doctors prescribed hormone replacement therapy as the solution. Then came the studies linking it to increased cancer risk. Millions of women found themselves searching for alternatives. And many of them discovered a plant that Native American women had been using for centuries. A tall woodland flower with white feathery blooms that grows in the forests of eastern North America. The Cherokee, Iroquois, and Algonquin tribes knew its power long before modern medicine existed. They called it by many names, but today we know it as Black Cohosh. And the scientific debate surrounding it has made it one of the most controversial plants in women's health. The history of Black Cohosh is deeply rooted in Native American healing traditions. Indigenous women used it for a wide range of conditions related to female health. Menstrual cramps, difficult childbirth, and the changes that came with aging were all treated with this plant. The name Cohosh itself comes from an Algonquin word meaning rough, referring to the plant's knotted root structure. European settlers quickly adopted the remedy from native healers. By the mid-1800s, Black Cohosh had entered mainstream American medicine. It became a key ingredient in Lydia Pinkham's vegetable compound, one of the best-selling patent medicines of the 19th century. Marketed specifically for female complaints, this tonic made Black Cohosh a household name. When pharmaceutical medicine rose to dominance in the 20th century, Black Cohosh faded from American medical practice. But in Germany, researchers continued studying the plant with rigorous scientific methods. Their findings led to Black Cohosh becoming an approved prescription medication for menopausal symptoms. Today, it remains one of the most widely used botanical remedies for women's health issues worldwide. Black Cohosh belongs to the buttercup family, Ranunculaceae. Its scientific name is Actaea racemosa, though older sources may use Semicifuga racemosa. The plant is native to the deciduous forests of eastern North America. It grows from southern Ontario down through Georgia and west to Missouri. Black Cohosh thrives in rich, shaded woodland environments. It prefers the moist, well-drained soils found beneath mature, hardwood canopies. The plant is striking in appearance. It can reach heights of up to 8 feet when flowering. Large compound leaves create a lush, tropical appearance unusual for North American woodlands. In early summer, tall spikes of small white flowers emerge. These feathery flower clusters give the plant another common name, fairy candles. The flowers have an unpleasant odor that attracts flies and beetles for pollination. The medicinal portion is the thick, blackened rhizome that grows underground. This gnarled, knotted root is harvested in autumn when the concentration of active compounds peaks. The black color of the dried rhizome gives the plant its common name. Wild harvesting has reduced natural populations significantly. Conservation efforts now encourage cultivation to protect wild stands. The chemistry of Black Cohosh has puzzled scientists for decades. Despite extensive research, the exact mechanisms of action remain incompletely understood. The rhizome contains a complex mixture of bioactive compounds. Triterpene glycosides are considered among the most important. These include actine, 23-epi26, deoxyactine, and simicifugicide. These molecules have demonstrated biological activity in laboratory and animal studies. However, their precise role in relieving menopausal symptoms is still debated. Phenolic acids, including caffeic acid and isoferulic acid, are also present. Flavonoids contribute antioxidant properties to the overall chemical profile. Alkaloids, aromatic acids, and resins round out the complex mixture. For many years, researchers assumed Black Cohosh worked through estrogenic activity. The thinking was that plant compounds mimicked estrogen in the body. This would explain relief from menopause symptoms caused by declining estrogen levels. However, more recent research has challenged this assumption. Modern studies suggest Black Cohosh does not bind to estrogen receptors in significant ways. Some researchers now believe the plant works through serotonin pathways instead. Serotonin plays a crucial role in body temperature regulation. Dysfunction in serotonin signaling may contribute to hot flashes. Black Cohosh compounds may influence serotonin receptors, providing relief through this mechanism. Other proposed mechanisms include effects on dopamine pathways and opioid receptors. The truth may involve multiple overlapping actions that are difficult to separate. When Black Cohosh compounds enter the body, they produce effects primarily relevant to menopausal symptoms. Hot flashes represent the most common complaint during menopause. These sudden feelings of intense heat affect up to 80% of menopausal women. They often accompany flushing of the face and neck, sweating, and rapid heartbeat. Clinical studies have shown that Black Cohosh can reduce the frequency and severity of hot flashes. The effect typically becomes noticeable after 4 to 8 weeks of consistent use. Night sweats, which are essentially hot flashes during sleep, also respond to Black Cohosh treatment. By reducing these episodes, the plant may improve sleep quality indirectly. Mood changes during menopause include increased anxiety, irritability, and depression. Some studies suggest Black Cohosh improves mood symptoms as well. This could relate to serotonin pathway effects if current theories are correct. Vaginal dryness and discomfort are common menopausal complaints. Evidence for Black Cohosh effectiveness on these symptoms is less consistent. Some women report improvement, while controlled studies show mixed results. Joint pain and muscle aches sometimes increase during menopause. The anti-inflammatory properties of Black Cohosh compounds may provide some relief. Sleep disturbances beyond those caused by night sweats may also improve. However, Black Cohosh is not a sedative and does not directly induce sleep. The pharmaceutical status of Black Cohosh varies dramatically between countries. Germany has led the world in researching and regulating herbal medicines. The German Commission E approved Black Cohosh for premenstrual discomfort, painful menstruation, and menopausal symptoms. German physicians commonly prescribe standardized extracts as a first-line treatment. The most studied formulation is a proprietary extract called remifemin. This product has been used in Europe for over 60 years. It is standardized to contain specific concentrations of triterpene glycosides. In the United States, Black Cohosh is classified as a dietary supplement. The FDA does not regulate it as a medication. This means products can be sold without proving safety or efficacy. Quality and potency vary widely between American products. American medical organizations have taken cautious positions. The North American Menopause Society acknowledges Black Cohosh as a potential option but stops short of recommending it. The American College of Obstetricians and Gynecologists takes a similar stance. Many American physicians remain skeptical due to inconsistent research results. However, millions of American women use Black Cohosh despite this skepticism. It offers an alternative to hormone therapy, which many women prefer to avoid. Beyond menopausal symptoms, Black Cohosh has been explored for other women's health conditions. Premenstrual syndrome involves mood changes, bloating, and physical discomfort before menstruation. Some evidence suggests Black Cohosh may help reduce these symptoms. Painful menstruation, or dysmenorrhea, was one of the traditional uses of the plant. Modern research on this application is limited but somewhat supportive. Polycystic ovary syndrome has been studied in combination with the fertility drug clomiphene, Some research suggests Black Cohosh may improve ovulation rates when added to standard treatment. However, this remains investigational. Uterine fibroids have been examined in preliminary studies. Some researchers theorize that Black Cohosh could help manage fibroid-related symptoms. Evidence is currently insufficient to make recommendations. Bone health is a concern for postmenopausal women due to declining estrogen. Some studies have examined whether Black Cohosh affects bone density. Results have been mixed and inconclusive. The cosmetic industry has shown limited interest in Black Cohosh compared to other botanicals. However, some applications exist. The anti-inflammatory properties have potential for sensitive skin formulations. Phytoestrogens in plants are sometimes marketed for anti-aging skincare. Whether Black Cohosh has meaningful estrogenic effects on skin is questionable given current research. Some hair care products targeting hormonal hair thinning include Black Cohosh. The theory is that modulating hormone-related effects might help with hair health. Scientific evidence for topical Black Cohosh benefits is minimal. Most research has focused on oral supplementation rather than cosmetic applications. The global market for Black Cohosh products centers primarily on menopausal support. Annual sales in the United States exceed $100 million. It consistently ranks among the top-selling herbal supplements for women. The European market, particularly Germany, represents a major pharmaceutical segment. Prescription and over-the-counter products generate substantial revenue. The supplement industry offers Black Cohosh in numerous formats. Capsules and tablets containing standardized extracts are most common. Liquid tinctures and combination products are also available. Many menopause support formulas combine Black Cohosh with other herbs like red clover, dong quai, and soy isoflavones. Wild harvesting remains a concern for the industry. Native populations of Black Cohosh have declined significantly due to collection pressure. The plant grows slowly and takes years to reach harvestable maturity. Cultivation efforts have expanded but still lag behind demand. Sustainable sourcing has become an industry focus. Some companies now verify that their Black Cohosh comes from cultivated sources. The scientific research on Black Cohosh has produced mixed and sometimes contradictory results. German studies from the 1980s and 1990s were generally positive. These trials showed significant reductions in menopausal symptoms compared to placebo. The research formed the basis for regulatory approval in Germany and other European countries. American studies have been less consistent. A major trial published in the Annals of Internal Medicine in 2006 found no benefit over placebo. This study examined Black Cohosh alone and in combination with other herbs. Neither approach outperformed inactive treatment. Another significant study called HALT examined Black Cohosh for hot flashes. Results showed modest benefits that did not reach statistical significance. Critics of the negative American studies point to methodological differences. Extract type, dosage, treatment duration, and patient selection all varied from European research. Some researchers argue that only specific standardized extracts work effectively. A Cochrane systematic review concluded that evidence is insufficient to support Black Cohosh for menopausal symptoms. However, the reviewers noted significant variability between studies. The scientific community remains divided. Some experts believe Black Cohosh genuinely helps many women. Others consider it no better than placebo. Individual response may vary based on factors not yet understood. Standardized Black Cohosh extracts typically recommend doses of 20 to 40 milligrams daily. Some products use dosing based on triterpene glycoside content. The most studied formulation provides 1 milligram of triterpene glycosides per tablet taken twice daily. Extracts should be standardized to ensure consistent potency. Look for products specifying triterpene glycoside content. Whole herb preparations, powders, and teas contain variable and often lower concentrations. Effects generally require 4 to 8 weeks to become noticeable. Patience is necessary when starting Black Cohosh supplementation. Treatment duration recommendations vary. German guidelines traditionally limited use to 6 months. However, more recent position statements have relaxed this restriction. Long-term safety data remains limited. Many practitioners recommend periodic breaks from supplementation. Black Cohosh should be taken with food to improve absorption and reduce stomach upset. Black Cohosh has a generally favorable safety profile, but important concerns exist. Liver toxicity has been the most serious reported adverse effect. Case reports have described severe liver damage in women taking Black Cohosh. Some cases required liver transplantation. However, causality has been difficult to establish. Many affected women were taking multiple supplements or medications. Product contamination or adulteration may have contributed to some cases. Regulatory agencies in several countries have added liver warnings to Black Cohosh products. Women with existing liver disease should avoid Black Cohosh. Anyone taking the supplement should watch for signs of liver problems. Jaundice, dark urine, abdominal pain, and unusual fatigue warrant immediate medical attention. Common side effects are generally mild. Stomach upset, headache, and dizziness occur occasionally. Rash has been reported in some users. A critical safety question involves breast cancer. Early concerns suggested Black Cohosh might stimulate estrogen-sensitive tumors. Current research suggests this fear may be unfounded. Most studies show no estrogenic activity on breast tissue. Some laboratory research even suggests anti-cancer properties. However, breast cancer survivors should consult oncologists before using Black Cohosh. Women who are pregnant should not use Black Cohosh. Traditional use included inducing labor, suggesting it may stimulate uterine contractions. Breastfeeding mothers should also avoid it due to unknown effects on infants. Black Cohosh is primarily intended for adult women experiencing menopausal symptoms. Women in their late 40s through 50s represent the core user demographic. Those with mild to moderate symptoms may be good candidates.